So if you're someone who is using spectacles and are keen to know what are currently the best technological advancements to give you the safest and the best long-term outcomes for laser vision correction, here we are going to discuss with you what is currently the cutting edge, the safest and customized approach for your vision correction procedure. I am Dr. Vardhaman Kankaria, a cataract and refractive surgeon at Asian Eye Hospital. Our family has been in refractive surgery for last 40 years and we started to perform spectacle correction surgeries even way before LASIK in 1985. As the time went by, we procured all the advancements with time, including LASIK, PRK, Femto-LASIK, Contura, SMILE, the Wavelight technology, and the current generation of EVO ICL procedures in the last 40 years. We have so far performed more than 2 lakh vision correction procedures on our patients in the journey of 40 years, and I am here in front of you to discuss what are the top choices as of 2025 if you are considering laser vision correction. Contura Vision is a high definition LASIK upgrade in which we are performing what is called as a topography guided laser treatment. In this case, a scan of the cornea understands 22,000 points, identifies irregularities in the cornea, and the laser not only fixes your spectacle number but also removes any tiny irregularities on the cornea, giving you much smoother corneal surface, much faster visual recovery and much better quality of vision even at the night compared to the LASIK procedure. Contura Vision is FDA approved and it is best suited for people who have myopic astigmatism, that is a combination of spherical refractive errors along with the cylindrical refractive errors. It is one of the procedures with the fastest recovery in which you can start normal life within 3 days. The next is Wavelight Plus Ray Tracing LASIK technology. The Wavelight Plus is a new next-gen LASIK technology in which a eye avatar is created from your entire ocular eye optics. So this specific device called as InnoVise calculates thousands of light rays which are entering your eyes and the way they reflected from each and every surface of the eye. Once your eye avatar is created, it is fed to the laser. The laser then modifies its own profile to correct any such irregularities not only on the cornea but in your entire optical media. This technology has recently got FDA approval and it is known to give very sharp vision in a very quick recovery. This is known to give you back to normal life in 3 days time so that you can join office work, and this is one of the top advancements which have come in the recent times. However, this technology is not for everyone. If there is a difference in your refractive error after we have dilated your pupil and before, then this technology will not suit your eyes. But if your eyes' ocular structures are very stable, Wavelight Plus can give you excellent visual outcomes, especially again in cases where you have a combination of spherical refractive errors along with cylindrical numbers and want very fast recovery. One of the other latest technologies is the SMILE procedure, which is also known as small incision lenticle extraction. This is a minimally invasive advancement in LASIK surgery, which is not only bladeless, but this is also flapless, making sure that you can get your vision corrected without creation of a flap, thus giving rise to much lesser amount of dryness, much better visual acuity, and they are best suited for people who have mainly spherical refractive errors and those who are in contact sports and have propensity to get any eye injuries in the future. SMILE has been one of the most robust technologies, giving very good outcomes. This technology is FDA approved for almost a decade and giving fantastic results for people around the world, where more than 4 million eyes have received it so far. While most people who have a correctable refractive error of less than 8 diopters have a very good corneal architecture, which is seen by corneal evaluation, do very well with the technologies such as Contura, Wavelight Plus, or even Smile laser technology. But there are many such patients who are not candidates for laser vision correction because either their spectacle numbers are more than 8 diopters or their corneas are simply not suitable for laser vision correction, such as corneas which are thin, corneas which are weak. These are also called as keratoconus suspect, or even patients who have a significant dryness. These patients are called as LASIK rejects. But the good news is that there is a great advancement even in people who have faced rejection for LASIK can have very safe and very good long-term outcomes with a technology called as EVO ICL implant procedure. So EVO ICL is basically a bio lens which is thin, it is rollable, it is biocompatible, and it is implanted in your eye in a painless fashion with a very small 2 mm cut at the corner of the cornea. This procedure has the advantage because this does not require corneal thinning, does not induce dryness in the cornea. It is known to be more stable in long run in terms of the refractive stability, especially if you are treating high spectacle numbers. And the most important, this is currently the only procedure which is potentially reversible, as your eye structure, your eye anatomy is absolutely untouched when the ICL is implanted in front of your natural lens, as it involves no removal of corneal tissue or any permanent change in your eye. This procedure works the best for people who have more than 8 diopter or spherical refractive errors, or whose eyes are rejected to undergo corneal laser correction procedure with thin corneas, keratoconus, and dry eyes. This procedure is FDA approved for last over 2 decades, but there have been numerous advancements in the design of these lenses, and the current design is called as the EVO ICL from Star Surgical. We have been using all these technologies for many years. We have been using the Contura and the Smile technology for almost a decade. We have been using the ICL technologies for almost 20 years, and we have been generally in spectacle correction procedures for almost 4 decades now. So with our journey, we have always seen that the science always moves forward. That means procedures, as they evolve, they become safer and better for your long-term outcome. So if you're someone who is considering a spectacle correction as of 2025, you have fantastic procedures at your disposal. But always remember that the decision of choice of the correction has to be done by your own surgeon. And as we have seen, all these procedures have different indications. So choose a surgeon which performs all these procedures under one roof and can check suitability of your eyes for one procedure over the other. I hope this video gives you the clarity of the choices which are currently known as the best in the world as of 2025, and helps you to make you relaxed, to alleviate your anxiety, and certainly to guide you to make the best choice. Please like, share, and subscribe, and keep following our channel for such informative eye educational videos in the future.